Welcome to the Point, presented by SSM Health Monroe Clinic Medical Group. I'm Kent McConnell, and we are visiting today with Steve Brewer, Vice President of Operations for SSM Health Monroe Hospital and Monroe Clinic Medical Group. Steve, welcome.
Thank you, Kent.
Let's get started today, Steve, by perhaps having you offer us a little bit of information about yourself, such as how you became interested in healthcare operations and what led you to Monroe.
Well, Kent, I guess I would say that healthcare has kind of always been of interest. Come from a healthcare family. My dad was a dentist. My mom was a nurse. I have an uncle who's a cardiologist. So just always have been connected with the healthcare field. And I even did chairside assisting for my dad as a dentist a long time ago when I was probably 12 years old. And he would say, "Hey, I need some help, and will you come hold the instrument?" So can't get away with that now, but that was my first introduction to probably the real in the trenches healthcare, if you will. And that interest just kind of continued. So I went on and got my bachelor's degree and actually in exercise science. So was always interested in health and wellness and that sort of thing. And then as I got into the healthcare field, I've done some work in cardiac rehab and physical therapy, and then ended up taking a different direction in my career and moving into the administrative side and got my master's in business and just continued to work with a lot of different physicians and healthcare systems and nurses, et cetera, along the way. So it's been a very nice journey.
And how is it that you ended up in Monroe, Steve?
Well, I'm actually from the area, so to speak. I grew up in Roscoe, Rockton, Illinois area, so not too far away. And I spent the previous 6 years up in Wausau, Wisconsin. But then as my wife and I became empty nesters, we kind of talked and said, well, where would be, important for us to be as we move into this kind of next phase of our lives? And we both wanted to be closer to our extended families in the area. And Monroe always had such a great reputation, both as a town and certainly Monroe Clinic as a healthcare organization. So when the opportunity presented itself, we both were very pleased to accept our next chapter and move here to Monroe.
Steve, back on March 12th, SSM Health Monroe Hospital and Monroe Clinic Medical Group moved to the SSM Health Electronic Health Record System. How about giving us some background on what prompted this transition?
Sure. In healthcare today, any, information or patient details, it's very important to have a comprehensive record. And as many folks know, right now it's the days of the paper charts are almost completely gone, and you need to have some sort of electronic record. And as Monroe Clinic, certainly had our own electronic record prior to joining SSM. But then once you join a larger system, it's very important to make sure that you're on the same instance, if you will, or version of the electronic record. And that just allows for a lot of different connections with not just with the physicians and the clinicians here, but also throughout our region.
Now, this means change. So I'm wondering, is change really better for the patients and the staff?
Absolutely. And it's we just went live on our new version or instance of Epic. And as we kind of make the rounds with folks, as you can imagine, we're going through some growing pains. And I had one of our team members acknowledge it or describe it as just kind of when you get a new cell phone and the buttons aren't quite the same and the functionality is a little bit different. But it doesn't take too long. You start to get used to it and you go, oh, that's actually a little bit better than what I had before. But certainly as we go through those kind of transformations and learning, being able to be on the same version and platform with the rest of our system, there's going to be so much more opportunity for sharing information, learning protocols for best care practices and evidence-based medicine and that sort of thing. So really will make for a much more seamless and comprehensive experience for our patients and our clinicians.
We're visiting today with Steve Brewer, Vice President of Operations for SSM Health Monroe Hospital and Monroe Clinic Medical Group. And Steve, how will patients or how do patients access the new MyChart portal?
Well, the first thing that they can do is just go to ssmhealth.com, and there will be clearly links there to the MyChart system. If they have a Monroe Clinic MyChart account, that will then also prompt an automatic creation of a new SSM MyChart account.
So I guess that leads me to, do patients still have access to see their Monroe Clinic MyChart?
Oh, absolutely. Certainly, for the next year, they will have complete access to their Monroe Clinic MyChart account.
Where can patients go, Steve, to learn more about this process?
They can go to www.ssmhealth.com/1Monroe. That's ONE Monroe. And there's just a host of information about how to create an account, check your passwords, and or get more information if they have any questions.
And if they wish to contact you, how could they do so?
Always happy to talk to folks, especially as we make our transitions and that sort of thing. So we can contact me by calling our direct line at area code 608-324-1328. Really, I'm looking forward to our continued development here, and thank you to everybody that trusts us with their care.
We've been visiting today with Steve Brewer, Vice President of Operations at SSM Health Monroe Hospital and Monroe Clinic Medical Group. I'm Kent McConnell, and this has been To the Point, presented by SSM Health Monroe Clinic Medical Group.